Alzheimer's disease and other forms of dementia are tragic and horrible in consequence, both for patient and caregiver. Trust me, I know. Today, our guest is Emma Soy, founder and CEO of Gentle Shepherd Care, which is dedicated to serving patients and caregivers alike. After more than 20 years of dedicated service as a nurse, Emma founded Gentle Shepherd Care in 2019 with a vision to redefine elder care and help older adults age gracefully in place. Hey, Emma, thanks so much for joining us today on our podcast.
Thanks, Bob. Thanks for having me.
It's my pleasure, Emma. I'm looking forward to our discussion. This is a really tough topic, and I hope that people who are dealing with any kind of illness like this will find some value in it. Can you tell us about Gentle Shepherd Care, what you do, how
Sure.
your approach differs from traditional care
Sure.
of those suffering from Alzheimer's and related
Sure.
diseases?
Bob, I've been a nurse for a very long time. I've been a nurse for over 35 years. I've done many things in nursing, various things in nursing. And in 2019, one of the things that I've been doing for the past 15 years is what we call geriatric care management, helping people coordinating care, coordinating services, whether it's in the hospital or in the community. And so that I've been doing for the past 15 years. But in 2019, I decided to add home care services. My goal at that point is to help the older adult who wants to age in their own home, aging in place,
Right.
whether they're living with any kind of chronic diseases. My goal was to help them to age with dignity, thrive, and to do more than exist, to actually have quality of life. That was
Yeah.
my goal.
Okay.
But what I discovered, basic home care does not provide that to clients, to patients. And I find myself just watching people just decline and providing the basic care, such as help me with my daily activity of daily living, wash me, clean me, feed me, walk me, things like that. But yet we were not doing anything to help improve the quality of life,
Okay.
whatever it is that they have. And so that's when I decided to do something about it, adding some what I know, some my knowledge, my experience into in caring, and to be able to provide care for the older adults specifically who are dealing with chronic disease, Alzheimer's, dementia, Parkinson's, from a different perspective, from a holistic point of view of looking at the whole person to be able to do that instead of just a fragmentation of care.
Okay. Tell me about Rejuvenate and your approach to aging and neurological care. What's that all about?
Okay. So I do have a new program called Rejuvenate. The program is to be able to is when I looked at the older adults that I'm caring for, there are
Uh-huh.
so many things that by the time someone is 80, 90, that they either were not interested some of the things that I wanted them to do, that I felt that those things could have been we could have been doing them 20 years before. So
Okay.
this program is specifically for someone, anyone 60 and above, to start looking at some of the pillar of aging, looking at some of the things such as chronological, biological aging, different things using technology today. I have one of the words that I'm using that is just not me, it's being used everywhere, is biohacking, using technology to add different things to health to help people to decrease and slow down the progression of aging, slow down the progression of chronic diseases. So that's what the program is all about.
Okay. Now,
Rejuvenate.
you say there are 7 devastating mistakes that families make
Yes.
when dealing with these issues. What are they and what are the solutions?
Okay. Again, that's one of the reports that we offer for free that families can download. Now, number one mistake that families make when caring for an aging person The focus usually is just basic care. Help me with my mom. But what I need is the focus is on activity of daily living. Feed me, wash me up, change me, make sure that I'm safe, the basics. And so
Hmm.
that's one of the mistakes. Without thinking about the underlying biological reason for the aging, I always say that people don't just fall. Older adults, one of the things that happens that brings them to a hospital is a fall. People don't
Okay.
just fall like that. So usually that's what triggers care. Somebody falls, something broken. No, there are things that's going on with the aging process that we ignore or we don't do anything about. So that's number one. And so that's the one number one mistake. The second mistake that family caregivers do, and again, they can get the whole report and they can go over that, is that they place people prematurely in assisted living without exploring alternatives because people think home care is expensive. But before you make such a definite decision, I usually recommend that families look at all aspect of care. First of all, have a plan. What I discovered when in 2019, beside the basic care, I also discovered, Bob, that most people do not plan on aging, how they want to age, where they want to age, and how much it's going to cost. And so, because there is not a definite plan, then people are always reacting to care instead of responding to care. To solve that, I help people put those kind of plans together so you can have a roadmap that would decrease the stress of caregiving. And I don't know if you want me to continue with the seven,
Well,
but
I want to interject there with respect to that basic plan in advance,
Mhm.
because I agree with you. I think that's what I know in my own case. I never thought about that 10 years ago. I didn't even think about it. I figured, no, those things happen to other people. They'll never happen to me. I found
Yeah,
out I was wrong.
yes,
And so now I'm in a situation in my own personal case where I'm trying to figure out what are the steps that I can take to
Mhm.
make my loved one have a better life. Not just,
Yes,
as you say, not just exist, but to
yes,
have a decent,
quality.
yes, quality of
Right.
life. And it's very difficult.
And Bob, quality of life doesn't happen. Quality of life, you have to plan it.
Yeah. Yeah.
You have to
I
plan
can
it.
see that. Yeah,
Yeah, you
sure.
have to plan it.
Yeah.
And it's an art. It's an
Yeah.
art.
Okay.
Caregiving is not, people think it's just easy. Oh, I'll just make sure my wife or my loved one is fed or what. That's not it. Caregiving is very, especially, we'll continue talking about what your wife is going through right now. This is not something people should be doing on their own because it is something that takes a professional to be able to do.
Okay. Why don't you continue? That was
Okay,
number
so
one and number two.
yeah, that's why I said it's people can certainly get that. But the other thing, so that's one of the mistakes that can, before I continue, I just want to mention something you said. The reason that people don't plan, Bob, is the same thing that you just mentioned. It's the same
Right.
thing that you just said.
Right.
People think they are afraid. They think if I plan, something bad is going to happen to them. Okay,
Uh-huh. Right.
so they don't want to think about it. They don't think about, people don't want to think about aging. Okay,
Right.
people don't
Right.
think it's about aging. It's going to come back, whatever. So I've been finding it very hard for me to sit down with someone who's 70, because when you're 70, 60, 70, that's the right time to plan, because at that time you can participate in the plan. You make it easier for your own children to implement for you or
Right.
anyone else who's going to help you, because
Mhm.
those are things that you pick yourself. Those are choices that you made yourself. And so
Right.
it's much easier for me to implement a plan that you provide to me than for me to create one for you.
Okay.
Okay,
Yeah,
so
I can see that. Sure. Absolutely.
yeah. So the third mistake that people make, they make decision for care mostly based on cost, whether instead of value.
Mm.
Okay, it's how much can I pay for this. So when we talk about quality of care, we have to go beyond the cost of care. Now you have, so you have cost of care, and you want to look at the total value and quality, because quality and cost, okay, when you talk about quality, of course it's going to be it's going to cost you more to have quality than quantity.
Yeah.
Does that make sense?
Yeah, absolutely.
And so when people are making decision for their loved one and you make it solely based on cost, that is going to impact the quality of care that the person receive.
Oh, okay.
Okay?
Yep.
Because you cannot, I always say to people when they're comparing assisted living and home care, I said, there is no comparison. Because if I'm providing one-on-one care to your wife at home, how are you going to compare that to assisted living? Of course, that's going to cost more.
Sure.
But what's the quality of life is she going to have? You're talking about one-on-one care comparing to 1 to 20. So
Yeah.
when you have one person providing care and they have 20 other caregivers, or they have 20 other patients they're taking care of,
Yeah.
what quality? That's the value is very different.
Yeah.
And
Absolutely.
so that's the mistake. The number 4 mistake that people make is waiting for a crisis. They
Uh-huh.
wait for crisis. Many families operate in denial about their loved ones, declining health or increasing needs until a crisis force them to take action. And usually this kind of approach only leads to a decision, rush decision. You have limited options at that time, and the options are usually the outcomes usually not so good. No one can make good decision when they are under pressure.
That's
And
true.
so the decision that you're making usually not the same. And
Yeah.
it's usually costs you more because you're making this decision under pressure. Mistake number 5, people taking on too much by themselves
Okay.
while they are trying to balance multiple responsibilities. A family caregiver think I can do this by my own. But caregiving is very complex. Caring for an adult is not taking care of, it's not like taking care of a baby where
Yeah.
the baby no longer they're not talking or you control their environment and things like that. It's not the same. So you're dealing with an adult who has habits, who have their own habits. They have their own ways of doing things. No matter what kind of disease they're dealing with, they're unable to care for themselves, but that doesn't mean they are not adults.
True.
And sometimes family caregivers take so much, they take too much on their own. They think they can do the job until they crumble. Because statistics shows that caregivers who are carrying this load heavy on their own, they either die before the care recipient or they die quickly after.
Mhm.
During that time, they forget to even take care of themselves. So you have that family taking just too much and they don't realize. Yes, it's very loving to be able to, you promise that your wife or your husband that you are going to do this for them. Yeah, but getting help outside to come and help you do it
Yeah.
is very important, especially if you're not going to place them somewhere and you're going to keep them at home. You need to bring help. What kind of help is very important? When do you bring help is very important to know. The next mistake that I cover is accepting conventional care that's just watch somebody declines. One of the examples that I use is this. When you have a patient, when you have a client, when you have someone living with a chronic disease, let's say memory care issues, if you decide to place that person in an assisted living, you're going most likely place that person in a memory care unit. The memory care unit is a locked unit. The only reason they lock the unit is for safety. So the person is not eloping, the person is not running away. So they lock the unit. The person can't go anywhere. The person is still only receiving conventional care. They're not doing anything to manage the memory problem. The problem that is bringing them to the institution is a memory care problem. What method, what pathway, What treatment are we applying for this person to either slow down the progression of the disease or help the person? I understand that there is no cure for Alzheimer's and dementia and memory issues, but there are a lot of things that can be done to be able to help slow down the progression of the disease. And so we can give that person that quality of care or quality life, whether they have 4 more years, 5 more years, that those years are quality. There are basic things that needs to be done for these people. So they're not just getting the basic conventional care, even when they are in an assisted living.
Okay. Okay.
Is it clear? Is that clear?
Yeah. Did you hit your number 7?
Number 7 is failing to implement other strategies to optimize the care.
Okay.
While focusing on safety and comfort is great, but many caregivers miss the opportunity of implementing other scientific-based approaches that can optimize the function of the person at the cellular level. There are so many things that are available today that can give the person vitality, cognition, or physical ability so the person can continue to thrive. And so those are the 7 things that I cover in my report that I offer to people that they can have.
All right. Tell our people how they can get this report.
They can get the report on my website. They
Which
can go
is?
to gentleshepherdcare.com.
Now you talked about some of the things that can be done. What are the hidden interventions that people can use?
I'll give you an example. I'm going to continue to use the memory care issue.
Okay.
When someone has memory care issue, it's a cognitive, it's a brain health. So if that's where they are sick, that's where the sickness is. There must be in their plan of care, there must be something that gears towards that brain health. Does that make sense?
Yeah.
There got to be something that we're doing on a regular basis to improve the health of the brain, such as brain exercises, such as the type of food the person eats, the sleep patterns. All of these things affect the health of the brain.
Okay. Okay.
Like, for example, nutrition is huge. I have a doctor that I use some of her protocol. She cares for patients with memory care issues.
Okay.
She's up in the West. So she has a unit where she has clients come in. She's only using nutrition to improve the life of those people. And some of them she's discharging from her memory care unit.
Wow, that's amazing.
Just by changing nutrition. Why? Because one of the reasons for memory care cognitive issues in the older adult with Alzheimer's dementia is inflammation of the brain. What causes inflammation of the brain? The type of food we eat.
Okay.
Over time.
Okay.
Now, is this easy? Of course, it's not easy, but that's where you bring the professional to be able to help make the kind of changes that needs to be made to be able to see the improvement that you want to see in your loved one.
Okay, so give our audience a little bit of a clue, though, as to what are the bad foods and what are the good foods.
Sure. So for example, bad food, any processed food.
Okay.
Older adults, period. I don't recommend older adults to be eating processed food anymore.
Okay.
You know how when we were younger, they used to tell us, don't eat this, don't eat this, don't eat that. When at that age, it is imperative that the kind of food that our older adults are eating, they are whole foods. They are fresh food, no processed food,
Right.
Number one, because of the chemicals, because that's what brought us here anyway. That's what's affecting the brain anyway. Okay? So you have the chemicals that's in this food and the processed food. Number two, the sugar.
Okay.
Sugar needs to be out. Most memory care units, what they feed our older adults? Cookies, bread, muffins. No more sugar for the person with the memory care issue. No
Okay.
more sugar, no more processed food, no more white flour, none of this carbs, those kind of type of carbs. They increase inflammation in the brain and is affecting the brain, is making it worse. It doesn't get better.
Okay. Okay.
That's one example.
All right.
So
Excellent.
just basic nutrition like that.
All right.
Now, I say that it sounds so easy, but it is not easy because sometimes the person has a specific way that they've been eating for whatever, 80 years.
One of the best sources of protein for people like this.
So for most older adults or memory care clients, I recommend a Mediterranean diet. That has good oil, okay, a good olive oil. It
Okay.
has, you have your healthy proteins such as salmon, for example. Now,
Mhm.
even salmon, you have to watch what kind of salmon you're feeding. Because if you don't have the good salmon, you can have the bad salmon where you're increasing mercury, which is affecting the brain.
Okay. Got it.
So then you have your good oil. So you have your good fish, and
Uh-huh.
then you have fruits and vegetables. Really,
Okay.
all the other stuff we slowly, because one of the things that I do is we look at what is the person eating. We look at what can we take off, and then we see what can we add. It's a
Okay.
slow process
Yeah.
because you cannot just automatically one day you just take everything out of this person's diet
Got
who's
it.
not used to that. So
Yeah.
that's what I do. I look at what the person is currently having. I look at what we could add. We look at what we can take away until we optimize their diet.
Okay. Now, one of the issues that caregivers might have would be how to come up with these healthy meals.
Well, that's what I do.
Okay, that's what you do. One of the issues, I think, might be the temptation to, instead of preparing every damn meal at home, just going out to
Mm-hmm.
eat a lot.
Yeah, yeah. So
Bad,
that's what the my
bad
so the, my
idea?
solution to that usually is when someone work with me. Not only we create a menu, but we have a meal planner. We create meal plans, and
Uh-huh.
we have somebody who comes in and create and do and prepare the meals for you.
Yeah. Okay. But
And
not everybody can be a client of yours. So how can, you know, regular people
everybody
who
can
are
be a client of mine.
so regular people who are watching this and listening to this cope with these kinds of issues.
I understand. One of the things that I do, I work with people at different level. You can either work with me one on one, or you can work with me in groups, which make it
Hmm.
less expensive. But if you're going to do it on your own, you can. So I recommend that people do prepare, choose a diet that is good. Today, one of the best diets for older adults is either a ketogenic diet, which is good fat, or you have a Mediterranean diet, which is a diet that is full of fruits and vegetables and good oil. And
Okay.
so if you choose to do that, then it takes discipline. The next thing you need is discipline.
Discipline.
Yeah,
Okay.
the next thing you need is planning.
Okay.
The next thing you need is consistency.
All right.
Now remember you're going to, especially let's say for your wife, remember she has a disease. You're dealing with a disease. You're dealing with somebody with a disease. So
Right.
when you start approaching her with those changes, just know this is not going to be like easy. So that's where the professional help come in, because sometimes bringing the change, she may not accept it that way.
Okay. All right.
When you bring a professional from outside, I don't know if you know that when a nurse or doctor walk in and tell somebody to do something, they accept it more than they take it from their husband or the wife.
This is maybe off topic, but it amazes me when I go to the doctor and the people that are working for this doctor, or maybe the doctor, him or herself, are fat. Why
Mhm.
is it? I don't understand. You
Mhm.
would think that they would understand the importance of healthy
Well,
diet,
it's not
healthy living.
exactly. So it's not a matter of not knowing the importance. It's all depending what's going on in people's lives, because there are a lot of reasons why people are fat.
Yeah.
Sometimes people think you fat because oh, the person is eating, is just doesn't have a discipline in eating, but it could be a lot. Being overweight and fat has a lot of aspect to it. So that's a different topic for another time.
Yeah, it is. Absolutely. But I just
It's
I
like
just
going to the
wondered I
dentist
just
and the
wondered
dentist
that
got
because
dentist.
we go to a doctor and all the, I don't know, nurses or techs or whatever they are that work there, most of them are really overweight. And yet they're telling you about what diet you should be having and all that. It just doesn't
Do
make
what
any.
I say, don't do what I do. Yeah, that's
Yeah,
yeah.
exactly right. Yeah, yeah. Tell me this. Why is it that the doctors push expensive institutional care instead of community solutions that can be helpful?
One of the things that we have to look at, I tell my clients all the time, I teach about holistic living,
Yeah.
which
Uh-huh.
is different than acute care because we live in a system, Bob. We live in a system. There was a system for everything. There was a financial system. There was a health
Right.
system. So until it takes someone the time to wake up, to see that you are in a system and you decide to get out of the system, you're not going to see any changes. Most of us in healthcare is part of the system. Healthcare focus on taking care of sick people, not well people.
Hmm.
That is why in healthcare we have so many specialists. You have a specialist for every organ of your body,
Right.
and none of them talk together. Now, currently, the only reason why your body is still functioning is because every organ is talking.
Okay.
But when if you take your arm and put it, you cut your arm from your body and you lay your arm out here, it's not going to be good for a long time. The only way your arm continues to function is when it's connected to the body.
Yeah. Okay.
So that is why healthcare don't work that way because we're so fragmented.
All right.
You have a specialist for the heart, you have one for the eyes, you have one for the ears, you have one for the throat, you have one for every part. You have a finger doctor, you have an arm doctor. You go to the doctor, I tell my clients, you're having a heart attack and you are at a doctor's office, and because he specializes in the foot care, he tells you to call 911. He can't do anything for you because he's not a heart doctor. So that's how fragmented. So you ask me, I'm telling because our system is very fragmented, and our focus is in taking care of sick people, not well people.
Yeah, for sure. Absolutely.
And I'm going to put some of this responsibility to the society also. For years, society turned their most important commodity into the hand of other people, which is their health. Your health is the most important commodity that you could have. But yet, we just turn that over to someone else.
Okay.
We turn
Okay.
it over to doctors. We have no idea what they're doing with us. We just lay there and then whatever they tell us to do, but we don't take responsibility for our own health. We
Understood.
have to take responsibility for our own care. We do today. You do. Most people research everything that they're going to do before they buy something on Amazon. But yet, when you go to a doctor, they just write you a prescription. You just go. You don't even know what's in it. You just start. But people need to take responsibility. So I'm going to turn some of that to people, to the society too.
What policy changes do you think would help transform elder care?
So policy changes that has to be changed in elder care. But it's so sad in America, we don't take care of our older adults. We don't. We think just because somebody's old, we contribute every age, everything older adults tell us, we're like, that's aging. That's not true. Aging is not a disease. And so we need to have a different mindset everywhere, how people see older adults, because they don't think they can contribute to anything. So we ready to just throw them down and do nothing with them because they are 80 or 90 years old. And so the policy, and then there is no money to take care of older adults. You cannot expect an older person who barely makes any money. Like I was just talking to you about nutrition, and you said to me that well, the person, most people cannot afford me. Yes, most people cannot. That is too sad. That is sad. That the person has to decide whether they pay someone like me to help them live quality of life or pay their own pills or pay their own bills. So that's very hard. So policy, they need to be care. We need to be caring for the older adults, they shouldn't be, yeah, the cuts that are being made today in Medicare. I've been a nurse for 35 years. 30 years ago, we could see people in their home for a year, where nurses are making home visits. We looking over nutrition, basic things we do in education. With today, no, it's in, out, barely being able to provide the quality care that we can provide them. That
Yeah.
is terrible.
I wanted to ask you what you think about Trump's Medicaid cuts and healthcare policy changes.
Definitely. We don't know what that's going. We still have to see what that is going to look. But all I know is there was not enough room for cuts.
Yeah. I just
There was
know,
not enough room for cuts. And so
yeah,
if there are more, if we cutting more, I don't know how far that's going to go, because already it's bad.
I spent a lot of years as a healthcare journalist covering Medicare. And so I know that physicians and people in the healthcare industry that take care of patients have had a struggle for years and years over their level of reimbursement. And I'm seeing now that a lot of practices are moving to concierge situations where they're charging a subscription fee. If you want to go to this doctor, you got to pay an annual subscription fee before you even go there for any kind of treatment. Is that going to grow and be more prevalent as pressure
It will,
builds?
because it will,
Yeah,
because then you're gonna have. So the problem is you're gonna have less providers. You're
yeah,
gonna have less providers available to provide the care. So you're gonna have more people like me providing concierge nursing care. Like
yeah.
currently, what I do is concierge nursing. So we're
Okay,
providing, helping, supporting people living with chronic diseases. And then you have to pay for that, because Medicare those wonderful things that I do, Medicare do not pay for that.
I know
Medicaid do
that.
not pay for that.
I know
Right?
that. I know
So
that. Yeah,
this kind of basic care that I'm telling you about is just it's not that much different, but it's just a little bit better than the conventional care.
yeah, yeah.
The conventional care just give you the basic just to exist. I'm saying if we can just do just a little bit more, the person can thrive.
Yeah.
But if you want to thrive, then since Medicare do not pay for it, then you have to pay for that. So that is why a lot of providers are stepping away, because that's not why we went to school. We didn't go to school to provide low non-value care. Like we didn't go to schools. My model is compassionate care and helping people to thrive. But this basic care doesn't allow people to thrive. So
Yeah.
why am I saying thriving when I know it's not helping you thrive?
Understand. Okay.
So that's why you have a lot of providers stepping away from the coverage for Medicare, Medicaid, so they can provide quality care to
Okay.
people.
All right.
They want to be able to practice medicine.
Okay.
They want to be able to practice nursing the way it should.
Yeah. So Trump says there'll be no cuts to Medicare, but they're backwards. Is that
I
the right
guess we
word?
just have to wait and see the changes that are being made.
Yeah.
I don't doubt it, but if you're making cut in Medicaid, I don't know.
No,
Medicaid is
I
not
meant
paying every
Medicare.
cut.
I meant Medicare. He said there'll be no cuts in Medicare, but
Okay.
if doctors are not being paid what they need to be paid for various procedures that they perform, and they stop taking Medicare patients, that's a cut in Medicare.
Yeah, that is. Yeah.
And
Yeah.
it's a backwards cut. And it's
Yeah.
one that the Democrats can't really criticize because they haven't provided, when they were in power, they didn't provide decent rates either.
No, no. And I have to tell you, I remember when we implemented Obamacare. I was a care manager myself
Uh-huh.
at that point.
Yeah.
I can't find people. You can't find providers to take your people with Obamacare.
Yeah.
So the few people that are taking it, so they are overloaded.
Yeah.
So one person could have, that's one of the reasons why you have doctors doing concierge medicine, because they can choose to care for 100 people instead of 10,000.
Yeah.
So
Okay.
they can give you the time of day.
Emma, it's been a delight talking to you, and I learned a lot, and I hope that our audience did as well. How is it that people can contact you if they want to?
Sure, go ahead and go into gentleshepherdcare.com. You can contact me there. Call me directly, 704-209-5040. That's our regular phone number in our office. We are always ready to speak to anybody. We offer free discovery sessions. If you have a concern, you want to talk to me, it's a free 20 minutes discovery session where I listen to what your needs are. I give you recommendation of what you can do.
I wanted to ask you this. You're located where?
I'm located in Charlotte, North Carolina, but I work with people throughout the country.
All over the place, right?
Yes.
All right. So you do a lot of online work?
Virtually, yes.
Yeah, virtually. Okay. All right. Emma, thanks so much. I appreciate it. Is there anything else you'd like to add?
No, thank you for having me today. I appreciate it. I really love the interaction of going back and forth, and especially when you said you used to be a healthcare journalist, then you know what I'm talking about. So it's good. It's a good conversation.
I do.
Yeah.
Thank you very much. Hey guys, I'm Bob Gaddy, founder and host of Lean to the Left. I'm excited to share our new book, Hijack Nation, Donald Trump's Attack on America's Greatness, co-authored with political analyst and professor C.J. Waldron. In Hijack Nation, we delve into the unfolding story of America's political landscape through a series of essays from leantotheleft.net. We explore how Donald Trump's presidency has transformed American politics, challenging our values and institutions. Hijack Nation isn't just a book, it's a call to action. It invites you to reflect on what it means to be American in a divided political landscape. Together we can reclaim our nation's greatness. So get your copy of Hijack Nation today. Visit leantotheleft.net and click on the Books tab to learn more and to order.